when you first start doing this, and either with how the patient is positioned or how you're using the ophthalmoscope. Okay, so now if I were to look into the patient's fundi right now, we've talked about the exam, we're going to darken the room, we've done that, and I may be really having to lean over quite a bit, and if I feel myself in an awkward position, it's going to be even more difficult for me to look at what I want to see. So I'd have to ask her to please sit up straight and perhaps turn a little and get to the end of the table. And again, don't move your eyes. Focus in on the clock or the knob on the cabinet over there. And again, holding her shoulder helps position me so I'm not falling over as I'm trying to look in on her retina on this side. Okay, and so it's important to position her properly as well as for me to use the ophthalmoscope in a way where I could see what I want to see without being in an awkward angle. A critical point about the ophthalmoscopic exam is to hold the ophthalmoscope very close to your face, actually with the top against your eyebrow, in the lower portion against your cheek, this close to your eye, and so you could turn your head, ophthalmoscope and hand in one motion. And when you're going to start looking at the patient's eye, you're going to start with the black or green numbers, which are positive diopters, at around number 8 or so, 8 or 10. And at this distance, observe the red reflex. And as you're getting closer to the patient, slowly turn the diopter dial towards 0. And as you're getting closer, looking at the optic disc and retina, you may need to slowly move into the red numbers, the negative diopters, or back into the low green or black positive diopters to get into focus. And now we've put the room lights back up. Just for a moment, because I want to also check the pupillary light reflex. Okay, so what I'm going to do now is briefly shine a light in your eye. We're going to do the same thing, just staring off at that spot, that target on the wall. Okay, so again, the light would be dimmed, and you're staring off, and we're going to look at the pupillary light reflex, shining light in one eye, and seeing that that pupil constricts as well as the other one, and then in the other eye. So now the lights are up for a while. We're going to look at the eye movements, the extraocular muscle function, okay? And what I'd like you to do, I want to see how your eyes are moving. So if you could just stare at my finger, I want you to hold your head still, okay? And follow my finger with your eyes. Don't move your head. Okay, so we can look this way and up and down. Follow me over to this corner and up and down, and we can even check in the midline directly up and down. Okay. The next thing, now those were cranial nerves 3, 4, and 6. We've tested cranial nerve 2 already. Now we're going to move on to the 5th nerve, so we're going to check for facial sensation. We're going to screen for it. And a good way of doing that, as well as the sensory exam later, is perhaps to use a cotton stick applicator. Okay? And tease the head of the applicator to get a little wisp of cotton. And we could actually snap the stick to get a pokey, sharper end for testing for pin later on. But for the facial sensation, I'm just going to use the cotton. And what I'm going to do, I'm going to test your sensation over your face with this little cotton swab. I'm going to ask you to close your eyes, okay? And just tell me when you feel it, okay, and where you feel it. Where's that?
On my forehead to the right.
Okay. How about there?
And to the left.
Are those pretty equal?
Yes.
Sensation? Okay. How about here?
My cheek on the right, cheek on the left, my chin on the left, and the right.
Okay. So what I've done is checked the 3 divisions of the trigeminal nerve sensory branches, V1, V2, and V3, over the forehead, cheek, and along the chin or jawline. Okay. Next, we're going to look at the cranial nerve 7, the facial nerve, and I'm going to see how your muscles are working in your face. So if you could raise your eyebrows up for me, and how about give me a big smile, show me all your teeth. Great. Okay. Next, we'd like to do the 8th cranial nerve and just screen for hearing, and this is rather crude, but I'm just going to see how you could hear the rubbing of my fingers. If you can close your eyes for me, okay?
Left, right.
Okay, or we could use a ticking watch or a whispered word in much the same way. Next step, we want to look at cranial nerves 9 and 10. And one way of screening for that, and you may need to grab the ophthalmoscope or otoscope or your pen light to look inside the mouth. Could you open your mouth for us? And tilt back a little bit and give me a ah.
Ah.
And here, what I've seen is that her palatal arch and uvula rise symmetrically in the midline. Now, that really doesn't technically test cranial nerve 9. That's probably testing cranial nerve 10, the motor function of elevating the palate in the uvula. Now, if you really wanted to test cranial nerve 9, that would involve the gag reflex, which is sometimes distressing the patients. So we're skipping that for this screening exam at this point in time. The other thing I like to do is, if you could turn that way, can you just cough for me? Okay, so her cough sounds normal. And the other thing is I want to test some muscles around your shoulders here. So I've got my hands on